Hello everyone, this is Dr. Singh. I'm the medical director at HEALOR and Rare V. Today we are doing a feminization procedure using estradiol pellets. In this case, our client is extremely concerned about not having any sort of visible marking or scar that she had this procedure done, as she's a professional model and wants to make sure that there's no visible scar. So we'll be utilizing a different technique for palate insertion, utilizing skin creases. This technique is not commonly used because it is technically a little bit more challenging and the rate of complications can be higher, especially in an untrained hand. We'll be numbing the skin crease area and we'll be advancing the pellets, and these pellets will start dissolving in about 7 to 10 days. In this case, we are utilizing 250 milligrams of estradiol, which is a good starting dose for her. If we feel like she needs more, at the next procedure we'll be increasing the dose to 300 milligrams. So let's go ahead and get started, and you will learn about this new technique for pellet insertion with no visible marking or scar in the gluteal region. So just a tiny poke, okay? Just a little lidocaine, okay? Stings a little bit, that's all. Okay, there you go. Good. Almost done. Good. Almost done. Just put in the pellets. So you can see that's the really small scar. Just hold it together. So this is a waterproof dressing, okay? So shower is okay, but like I said, no sitting in